But I want to address an issue that came up a week ago in some public dialogue regarding Westchester County's funding of mental health programs. There may be a little bit of speculation online, and there was a comment made at a public forum where someone said that Westchester County is defunding mental health. I want to address that straightforwardly. That comment may have been made out of ignorance of what we've done, but let me give you the facts exactly of how we in this government have handled our concerns for mental health funding and through our Department of Community Mental Health. Our first year in office was 2018, and when we came in, the total budget for the Department of Community Mental Health was $58 million. The budget for the current year, 2024, is $90.5 million. That is a 56% increase in the amount of money that we as a county government are spending to try to address mental health issues in the county. $58 million up to $90.5 million. That's not defunding. That is funding at a very robust level. In 2018, the head count, the number of employees in the Department of Community Mental Health, was 69 positions. This year in our budget, we have 99 positions. That is a 50% increase from 66 to 99 people who are there to help administer these programs. But as important as the increase in funding and the increase in staffing is, the new programs that we've launched are particularly important. Let's outline a couple of them. We've talked a lot here about Project Alliance. That is our mental health crisis response team. This signature program came out of the police reform effort that happened here in Westchester County. We impaneled a police reform group, even at the time that, the governor of the state had required it of all governments. We initiated that 4 years ago. They came up with a number of recommendations, and one of the most important recommendations was to put together a program that has two basic components: training dispatchers who would be able to identify an incoming 911 call to determine that there was a mental health issue that was at hand, and then also the ability that we would have a mobile crisis response team that could cover any place in the county in a moment's notice to have mental health providers respond with police whenever an incident occurred that was reported to be a person that's having a mental health incident. We have trained over 940 dispatchers, which is an unbelievable number, over the course of the few years the program has been in. And we've also included in that the tour commanders, the people that are in charge of the incident when they're responsible at that moment in time. And this is training, professional training, to effectively respond when these 911 calls come in. We have created 8 separate mobile crisis response teams, and they're in 8 different nodes around the county to be able to respond in quick time, whether the incident occurs in Yonkers or Mount Vernon or anywhere in the county, in Ossining, in Mount Kisco, and not just in our urban centers, but in our suburban communities, in Harrison, in North Salem, in Cortland, in any of those locations. In the first quarter, just the first quarter of 2024, the teams responded to 724 calls, and that led to 2,300 follow-ups to ensure coordination of services. That is a significant implementation of a program recommended by our police reform task force. Opioid settlement funded programs, $4.2 million in opioid settlement funds, including $2.9 million for treatment services made available in this county government in this budget, $776,000 for prevention and recovery services, and $422,874 for harm reduction services. We want to thank our State Attorney General Letitia James, whose successful prosecution of opioid settlement cases has allowed certain revenue to come into this county and other counties targeted specifically for these programs. And these programs are essential for us in dealing with the expansion and, frankly, the explosion of opioid addiction all across our county. We have reopened mental health clinics. The county is investing $1 million to reopen the first of 2 safety net mental health clinics, reversing prior closure of those mental health clinics that occurred before our administration took office. This clinic will be co-located with the county's public health clinic in a secure, confidential area. Children and adolescent services. In the area of children and adolescent services, we have created a children's cabinet and have received $2.75 million SAM SHA grant for adolescent, young adults co-occurring treatment. With our additional county resources, we have more than doubled our school-based mental health clinics from 34 to 74 countywide. That's a significant increase. These are new initiatives in addition to our ongoing programs: suicide prevention, addiction recovery, prevention and adult services. You may recall we opened up an area in Ridge Road Park called the Healing Garden as part of our efforts to deal with suicide prevention, and in those cases where there had been a completed suicide, that those people who are relatives of the person that we've lost have a place to go and deal with that important loss. We've done many, many things under the great leadership of Michael Orth, who is our commissioner of the Department of Community Mental Health. And as you've seen already, as we've discussed already today, our solid waste department and what they've been able to do, what our Department of Health has been able to do, our Department of Consumer Protections. You've seen our intergovernmental relations with one of our local officials, the EMS efforts. We're working in numerous different ways in this county government to be proactive and progressive in the way we handle these issues. So if you happen to hear an errant comment about defunding mental health, you have the facts. And the facts are clear. We have fully funded mental health, and we've increased that funding, and we've done things in a progressive, responsible way, and we've done it cooperatively, all of us together, the Board of Legislators, those of us in the executive branch, and we are light years ahead of other counties around us in being able to address those issues.